welcome to another episode of TeqTalk. I am your host, Jas Kaur, and today we are delving into the healthcare payer industry. Our guest today is a seasoned professional with vast experience in this space. We will talk about the challenges payers face, how they balance the cost and quality, the evolving role of technology in this sector, and a lot more. Let's jump right in. Hi, Srikant. Thank you so much for coming to the show.
Thank you, Jess. Looking forward to being part of it.
Okay, so let's start. I know that you have a great experience in the payer side. So let's start with payers' challenges, right? So payers really play a very, very important role in healthcare industry, and it manages both cost and quality for million of people, right? But in today's rapidly changing healthcare landscape, payers face several operational and financial challenges related to the cost. They are having issues with the regulatory pressure and need to provide more quality care in a very, very competitive market. So would like to understand from you that how it is going on in the industry itself.
Yeah, sure. I am actually working as a Salesforce Principal Solution Architect in this particular industry. And what I can say is that definitely players are facing many challenges, rising healthcare costs. They're continuously rising with because of like chronic conditions, pharmaceuticals, and patients wanting advanced medical treatments. And
Mhm.
then another thing I'd say is value-based care. A lot of patients are transitioning from fees for services to value-based care based on patient outcomes.
Mhm.
And so this actually requires the implementation of the UK models and complex payment structures.
Yeah.
Then there are a lot of another areas, regulatory and compliance burdens. So a lot of these health insurers are basically have to face new healthcare regulations, including like federal laws, and also like the Affordable Care Act, as well as the state level legislations. Another area is data privacy and security, with privacy regulations such as HIPAA, as well as the CCPA, the California Consumer Privacy Act, protecting patient data. And all these things are areas that peers have to constantly work on and be on top of.
Mhm.
And then also patient-centered care. Patients are demanding better patient experiences. Earlier, it used to be like where patients, if they were sick, they used to go to the doctor, but now they want improved like member engagement and much better customer service. And also areas like telehealth as well as telemedicine. And this is something patients are adopting more, especially since the COVID pandemic. People like more remote and things like that, and not really seeing going to the doctor. Another area is also patients are looking at remote patient monitoring and other digital health services. And so yeah, and then these are like the general areas. And then also another important area is population health management, addressing like the broader social determinants of health, and then like things access to care or improved health outcomes across large populations. And
Right.
that's one of the important areas. A lot of companies that are in the forefront of this area are looking at using tools, Salesforce Data Cloud, because it integrates really well with their on-premise systems in a zero copy way.
Yeah,
That's
of
one of the
course. Yeah, so we'll be discussing about the technology and definitely Salesforce Data Cloud and all of that in a
areas.
couple of more minutes.
Yeah.
So, following with what you have mentioned, so there are a lot of challenges right now, right,
Yeah.
for payers, and the two important factors are right now cost and the care quality. So, what are the strategies used by payers to maintain the cost, give high quality care, and nowadays where the customer or the patients are expecting kind of hyper personalized care, right? So, some of the strategies which you can explain would be great to know.
Yeah, sure. So I think around these costs and all that. Some things that really help in this area are things doing value-based care. A lot of payers are adopting basically value-based care, which is based on the quality outcomes of care, rather than just the normal fee-for-service care that was that used to be the norm. But now people are looking more at value-based care. And then also they're also looking at having preventive care and for the management of chronic diseases
Hmm.
to avoid costly hospitalizations and unnecessary procedures. And that's something payers are looking at a lot.
Yeah.
And also, like basically, reducing hospitalizations and improve
Emergency visits. Yeah.
yeah, exactly, emergency visits and so on.
Hmm.
And in order to like achieve this, a lot of payers are implementing care management programs, and this involves identifying high risk or high cost patients with, for example, chronic diseases, and providing them with tailored care plans. And these care plans include frequent monitoring, preventive care, as well as coordination between all the caregivers as well as providers. And another thing is controlling costs. And this is in order to do this, they are focusing more on early intervention, managing chronic diseases,
Yeah.
and this can reduce, like you said, the need for expensive emergency care or hospital stays as well as advanced treatments. And yeah, it's basically also focusing on lifestyle and behavior intervention,
Yeah.
and then this like really helps in like managing these chronic conditions.
They are becoming more proactive than before, which was reactive. And
Yeah.
I think the landscape is pretty much changing and it is evolving from, I think, a decade or so. If you see now, the payers are evolving in the care management practices with, that is what I have mentioned, that from reactive to proactive approach, right? And so we have seen a major shift in the payer and the provider and the member interaction as well, right? So healthcare has become more patient centric and value driven than it was before, and payer provider relationship is also evolving a lot, right? So we have noticed a significant shift in how payers are interacting with both providers and members in the recent years. So let's discuss more on what are driving these changes. And uh, as a whole, payers are interacting with the providers, they are interacting with the members, they're interacting with the patient. They're kind of core to all the entities now. So, help our listeners understand that how payers are adapting to these new expectations and model of care. This is not very easy. This is pretty complicated inside. I know that. But if you can give some insights, going to be really beneficial.
Yeah, sure. So I think like the way payers and providers are interacting, as well as
Hmm.
members these days, is actually driven by many factors. Things like value-based care initiatives, basically shift from like fee-for-service to value-based care models, as well as led to like many new payment models, such as accountable care organizations, as well as bundled payments. And these require continuous coordination between the payers and providers,
Hmm.
and also regulatory frameworks like the Affordable Care Act,
Yeah,
as well as Medicare Access and the CHIP Reauthorization Act (MACRA) have really accelerated the shift to this value-based care. And then it's more moving towards like consumer-driven healthcare,
exactly.
and it's healthcare has become much more consumer-centric. And basically the members, they expect like the same level of service they receive in other industries, the retail sector as well as the banking sector. And also peers are offering much more like self-service digital tools like member portals, mobile apps, and care comparison tools. And like these really help the members to make informed decisions. And peers are also providing like access to telemedicine services and
Yeah.
online health resources as well.
I was about to talk on that as well. So, post COVID, you might have seen that there is a massive shift on telehealth services, right? What do you see? How it is? What percentage has grown in this area post COVID?
It's grown pretty exponentially. Like around like right after COVID, most of the interactions were using telehealth, because
Mhm.
there were no vaccines and people really
Yeah.
couldn't go to didn't go to see the provider. I mean, now it's kind of like I mean, patients are also going to the doctor when they need, but definitely they're leveraging telehealth services because the payers offer more incentives for that, and they have to like like the payments that the patients have to make, and the co-pays and all these are much less avail of those facilities.
Yeah. And I think it is even good for the patient as well as for the care providers as well, because unnecessarily, if they are, if people are just visiting care providers, it's like chaos, right? And the real cases, emergency cases, are not being taken on priority on that case. So I think it's a good add-on to what we had before. Telehealth is really picking up, and even home health is really picking up. So that's amazing, and giving a kind of relief to all the patients, those who cannot visit the hospital or the providers.
Exactly. And like something else that they're also doing is they're integrating digital health tools, wearables, and
Yeah.
remote patient monitoring devices. And like these technologies definitely enable like continuous monitoring of chronic conditions, and they like provide really good touch points between the payers, providers, as well as members.
Of course, yeah. That is something we are going to discuss when we discuss technology, that how it is,
Yeah,
how Salesforce and other different hyperscalers are integrating things. So we have done a little bit of research and have found that you have great expertise on these two key processes, right? Utilization management and prior authorization. So both of these are really essential for managing the cost and ensuring the kind of quality care. So let's discuss about all of these two and how they fit into the overall strategy of payers.
sure, absolutely. So yeah, utilization management and prior authorization are definitely essential components of basically like the purpose of utilization management involves evaluating the necessity, appropriateness, as well as the efficiency, of the medical services and procedures that are like being offered. And
Mhm.
it's basically how it like fits into the payer strategy is cost control, because like
Mhm.
the PIM is designed to manage healthcare costs by ensuring that services that are medically necessary and consistent are like provided, and payers also assess whether a service is the that particular service is the most effective option, and this helps to prevent like unnecessary test procedures or treatments that might otherwise inflate the costs.
Mhm.
Another thing is also quality of care, because like with like utilization management, this ensures adhering to the clinical guidelines and best practices,
Mhm.
and like patients receive the care that's evidence based and aligned with their health needs. Another important area of is like care coordination, because like it involves like collaboration between the payers, providers, and members,
Yeah.
and to ensure like only the right services are delivered at the right time.
Yeah.
And yeah, this coordination also helps reduce hospital readmissions and unnecessary ER visits, as well as complications that can arise with improper care otherwise.
Sure.
So prior authorization, that's the process where the healthcare providers must obtain approval from the payer before delivering certain services or medications.
Yeah.
And this actually ensures that the payer agrees to cover the service, confirming its necessity and alignment.
One quick question. Is there
Yeah.
any case or is there any corner case where they do not require prior authorization? They have
Uh,
their own section of providers who can give the authorization. Is there any case like that, or every time they have to go and get prior authorization from the care providers?
So that's something they're trying to automate based on like the certain conditions of like the patient. One case I can think of is suppose the patient was already getting a certain medication, and
Yeah.
say they change insurers,
Mm-hmm.
and they move to a different insurance.
Mm-hmm.
Then more in most cases that prior authorization is automatically approved,
Okay.
because they are already getting that from the previous insurer that they had. That's one of the cases I can think of, and
Yeah,
most
and
payers
what
are
I'm
working on
thinking
this.
is prior authorization can be seen as a hurdle in delivering timely care, right? It may take some time to have prior authorization if it is not automated. So I would like to know from you more that how is the speed up of approvals in different sections going on, or it is all approved already, and if it is all automated, it becomes much easier. So can you
Yeah,
let us know on?
yeah,
Yeah,
absolutely. This is actually a mandate
yeah.
from Centers for Medicare, etc., in order to get these things automated.
Yeah.
And so, like, well, my peer, and I think, and a lot of peers are actually currently working on getting this implemented, because right now it's a very manual process, and it can
Mm-hmm.
take days.
Right.
Patients are waiting to receive these authorizations. Providers cannot approve this, and like it's sometimes it can be a matter of life and death, and
Yeah,
because
of
in some
course.
situations, because of the delays. For example, if you're talking about costly like chemotherapy treatment for a cancer patient
Mhm.
and things like that. And so this is something, there's a mandate right now to automate this, and if possible, provide it the same day.
Oh yeah. So that was my next question, that how sooner it can be automated. Like if you mentioned same day, so that is again a good thing, right? The wait time and the approvals will be pretty speeden up in that case.
Exactly. Yeah,
Yeah.
absolutely. Especially for autoimmune diseases or cancer
Yeah.
therapies and areas that.
Yeah. Okay. So you talked about prior authorization. Now, let's talk about utilization management. It plays a key role, right, in ensuring appropriate care is being delivered at the right time. So, from your experience, if you can highlight some of the most significant bottlenecks and some of the ways which are still manual that can be automated inside these processes so that it can become much more beneficial for the users.
Yeah. So some of the there are many manual processes you just mentioned, as
Yeah.
well as administrative burden that like always serve as bottlenecks. And we also already discussed prior authorization, because
Mm-hmm.
prior authorizations are still highly manual, and they require like a significant administrative effort from both payers and providers. And this is the
Yeah.
case with most payers today, and they're all working on this because of these mandates to
Mm-hmm.
like automate this. And there's constant back and forth communication, which is manual, that's needed between peers and healthcare providers. And this causes significant delays in care and also increase in workload for the staff.
Yeah.
And this actually leads to like slower care delivery, patient frustration, and as well as provider dissatisfaction. And like there's also like a lot of paperwork that needs to be completed, and the this also like increases operational costs for peers, and like makes it very very inefficient, especially when you're doing like high volume processing, and which peers have to do. And also, like another thing is lack of interoperability,
Mm-hmm.
because peers often struggle with accessing and integrating data from multiple sources, whether it's hospitals, pharmacies, labs. And due to these challenges, because all these different systems, they have their own different data standards, and this makes it very difficult to exchange and consolidate information efficiently.
Yeah.
And yeah. So,
Yes. What I can understand is there is a wider space of having automation and making things seamless across the sector, right?
yeah.
And now in the era of AI, which is transforming many aspects in healthcare. So let's delve into how it is reshaping payer industry, particularly in prior authorization and utilization management, where your core strengths are. So we are seeing increased role for AI in healthcare. So, do you believe AI can really enhance decision making within utilization management and prior authorization? And you have already spoken about some of the automations which I'm already working on, but if you can add on top of that, would be interesting to know.
Yes, absolutely. I think like AI can definitely significantly enhance decision making within utilization management as well as prior authorization by improving efficiency, accuracy, and then I think the use of AI and ML in healthcare is already like starting to grow,
Yeah.
and these technologies definitely have the ability to transform how peers manage these care approvals, as well as optimize the utilization of healthcare services. I think AI powered automation can definitely automate a routine, low risk prior authorization requests. And this is, I think, the answer to the question you asked earlier. How can we automate these, allowing? And I think this is definitely something that can allow quicker decision making, and
Yeah.
also like reduce delays in care. And also another thing is data driven insights from complex
Absolutely.
cases, because AI can analyze vast amounts of data, healthcare data, including patient histories, clinical guidelines, and population health data, and it can really provide great recommendations for both prior authorizations as well as utilization management.
Yeah, absolutely. So, and I'm pretty sure for 80-90% of the payers organization, they're talking about AI, but they are still not there. They are starting up. So, when they're starting up, they are using technology to gather the data, right? So the first thing would be get the data in one space because the data is so much and it is so much in fragmented manner that the most important thing right now is to get the data into one repository and then further clean the data, make it good, and then start putting on AI on top of that. So, moving into the technology role in this operations which you're working on, how do you think technology is reshaping? You are working with Salesforce, Snowflake, and different other hyperscalers, right? You are building on the solution yourself. So, tell us more about it on high level, whatever you can share.
Absolutely. So sure. So what I've been seeing is that a lot of payers, including the payer I work for, they are
Hmm.
leveraging Salesforce Health Cloud
Yeah.
because it is used to manage member relationships,
Hmm.
streamline the workflows, as well as improve the collaboration between the various care teams.
Yeah.
And Salesforce Health Cloud, it includes member engagement as well as 360-degree view. It provides a comprehensive 360-degree view of members integrating data from the various sources, including claims, care plans, the social determinants of health. And this really helps the peers deliver personalized member experiences and better manage their health outcomes.
Yeah.
And the way it does it is like having all this member, it really streamlines our operations because having all of this member data in one place with it, payers can actually automate these processes such as like the prior authorizations, case management, as well as claims processing.
Yeah.
And it also, with Salesforce, you also get lightning flow and process
Yeah.
automation. And this really allows payers to automate many of the administrative processes that they have.
Yeah.
And then the Health Cloud can also be used to automate care coordination for high risk members.
Hmm.
And then another thing is Salesforce's platform provides the necessary tools for HIPAA compliance.
Yeah.
Because that's really a big thing, and it's a requirement in the healthcare industry. And this ensures that member data is securely stored and only accessed by the authorized parties.
Yeah, absolutely. So, if I can understand, you are using Health Cloud in your current organization. So, what are the inputs? I'm pretty sure there'll be different multiple inputs coming from different data sources, right, to Health
Yeah,
Cloud.
absolutely. Yeah, so like we have inputs from the EHRs,
Mhm.
the electronic health record systems, Epic.
So, multiple EHR systems, the data will be coming in. So, are
Yeah.
you using explicitly Data Cloud, or you are using Health Cloud, and that's only giving you 360 view of the customer
For this,
automation?
yeah, right now for 360-degree view of the customer, we're using Health Cloud.
Yeah.
However, my peer also uses Snowflake, and so they have this Snowflake system, which is and in Snowflake they have data of the peers, providers, as well as members. And so we are planning to use Health Cloud, Data Cloud, to get the data from Snowflake in a zero copy way because
Yeah.
Data Cloud has that ability.
Hmm.
And so that's something we're planning to use,
Yeah.
and yeah. And we
So,
also like use hyperscalers like we use like Microsoft Azure, and
mhm.
that's definitely one of the hyperscalers that we use.
Okay, that's great. So I hope you find Data Cloud very interesting. It has got a lot of features, and like how you mentioned, one of the very, very important features is no ETL, zero ETL, no copy, which you can definitely do with Snowflake. And would you like to talk more on the application side? What kind of application you are developing? One I understood is that you are trying to currently automate the prior authorizations, right? As a part of your current role and work. So, what are the different spaces you see that you can do a lot of automations using these technology stack?
So, yeah, so like one is like definitely prior authorizations, and
Yeah.
that's something that we already are working on right now because
Yeah.
it's actually a mandate and from
Oh,
Centers for Medicare.
is that become a mandate from the government side, or it's a kind of mandate from your organization side?
It's a mandate from the government side, like the Centers for Medicare Services,
Hmm.
and they have actually made a mandate that we automate like prior authorizations, and I
Oh,
think
that's
they've
very
made a
interesting.
mandate like for all payers, and
Oh,
so that's why that's something. It's one of the most important projects that we are working on right now, as well as
and
like
do you have kind of got some timelines or any deadline that, okay, by this time the prior authorization should be uh, automated?
I'm not sure of the exact date, but I think it's by early 2026 or something
Okay.
like that.
Yeah.
So yeah.
Still have some time, but I know this time is not, can literally fly if we actually start working and doing the automation work.
Right, exactly. And so that's why we've already started working on it.
Is there any other space you want to talk about where you are doing some interesting work in? in the payer side?
We also using Marketing Cloud for
Okay,
doing
very
marketing
interesting.
to reach out to our different members and audiences and patients. And so that's something also that's another reason why we want to start using Data Cloud, because that way we can actually segment and reach out to all these different populations and audiences, like
Yeah, and then
patients
you'll
and
have
providers and so on.
one-stop shop where you can do everything end to end using
Yeah.
Data Cloud, and you can be inside the Salesforce ecosystem. Yeah,
Yes.
that's pretty interesting.
Yeah.
Now you tell me what we can discuss more. All of what I thought have been discussed. Is there anything else you were to share with us? Something very interesting going on in your industry, technical wise, or some fact or some learning? Anything interesting?
Yeah, well, my learning is that one is that data is really important in the healthcare industry, protecting patients' data and so
Mhm.
on. And that's everything is based on trust and protecting that data.
That was very insightful. Thank you so much, Srikant. And with that said, we have to wrap up today's episode of Tech Talk. Thank you so much for coming to the show.
Thank you so much, Jas. And I really enjoyed this opportunity of, for participating in this Tech Talk, and looking forward to participating in more.
That wraps up our today's episode of Tech Talk. I want to thank Shrikant for sharing such valuable insights into the payer industry and transformative role of technology in it. It's been a truly enlightening session, and I hope our listeners are going to gain deeper understanding of how healthcare industry, especially the payer side, are adapting the evolving landscape. So if you enjoyed this episode, do not forget to subscribe to our channel and share it with your network. Thank you for tuning in, and we'll catch you next time on Tech Talk.